The grading is really important to know because it's unlike anything that we've seen. So I want to spend a little bit of time here. If you look at the bottom of the graph, we call these indirect findings. And if you look to the right, indirect or administrative QMS enablers considered to have indirect influence on medical device safety and performance. So they're not product specific. So when you get a citation from your notified body for an MDSAP, if you're in the indirect category, you could get a 1. But if you have a repeat finding, the next year it will be escalated to a 2. If you're in the direct section, if you look above in the red, it basically says directly impacts product safety and performance. So those are the design control tasks, the production tasks, the supplier tasks. So really understanding the differentiation between indirect and direct tasks becomes important because as you're prepping yourself, you're able to understand how to triage and prioritize based on what you're finding. The other thing to note too is if you have no data to support a task, they will automatically escalate it. So there's sort of an escalation pathway that notified body will take and approach as it pertains to how they grade your findings. And the final grade is capped at 5. And so we'll go through what that means if you get anything between a 4 and a 5 and how that impacts perhaps your certification. When we think about how this affects your certification, so as I mentioned, your QMS impact, so where does the cited clause sit? Then we look at if it's a repeat nonconformance, was a nonconformance at the same subclause cited in any audit previously? So again, that's going to raise the red flag and notified body is going to have to escalate it. If it's absent or not implemented, both must be true, and that will escalate it in terms of grading. And if it's specifically focused on a product or safety, that automatically elevates it to direct. So again, I know I'm going through this at a very high level. It is somewhat complicated if you're not familiar with it. So again, really important that if you're thinking about MDSAP certification in your future, this becomes a cornerstone to really understand so that you can assess your QMS in a risk-based approach and understand how you prioritize. When we think about sequencing, so what happens after your audit ends? So the auditing organization basically will give you 5 working days if you have a grade 5. So 1 or more grade 5 NCs requires almost automatic escalation, automatic responses. The other thing to note too is if you have a 5, they will upgrade that in the system. So again, if you recall, as I mentioned earlier, the participating agencies can go in at any time to the MDSAP system and see where you're sitting with respect to compliance. And so if you're sitting within direct findings and you're starting to see that as part of the audit report out, that information will be shared proactively with the participating countries that are part of your certification. Within 15 days, provide remediation plan for each nonconformity, investigation outcome. And again, just quickly, this is also listed. FDA has published a document that goes through all of this in more detail. It's listed on the top here. So again, a lot of really good references that you can access and bookmark just so that you can go back and do a little bit more due diligence for yourself. 30 calendar days, again, the manufacturer provide evidence of implementation of remediation activities for any grade 4 or grade 5. If you're not within that category, the notified body will just check effectiveness at the next inspection. But for grade 4 or grade 5, the requirements in terms of how you respond accordingly increases significantly. 45 days after the audit, submit audit complete report package to RA and the reps. So that's the auditing organization. So they're going to fine tune everything, get everything finalized, and that gets submitted to the auditing organization. And then everything essentially gets finalized and submitted. So pretty closed loop, pretty strict in terms of timelines. So they very rarely deviate from this. One of the things that I've experienced in my past is when you get a 4 or a 5, depending on your relationship with the notified body, it's definitely worth a pause and discussion because the implications could be very significant if you don't truly understand the why behind it. And if there's opportunity to present additional objective evidence to perhaps downgrade that, it's very important to do that as part of your audit so it doesn't get logged in and codified as part of the audit organization final reporting.